Mohebi, Parsa Mohebi Hair Restoration. Thank you so much for having me, Dr. Mohebi. So I wanted to get right into it because I honestly was confused. We were talking about it right before we went live here. The difference between non-shaven and long hair FUE. A lot of people believe that it's the same thing.
Yes,
Basically, they think that long hair FUE means that their hair on top is going to be long and they're just going to have FUE, and non-shaven, they think it's just the same thing. So if you could briefly go into the difference.
that's a good subject. Well, thanks for inviting me to the show. Um, basically, long hair FUE is when we remove hair with long hair. So from the donor area, we go and we have a special technique, a special devices that is capable of removing hair without cutting the hair shaft. So we remove it, put it in on the recipient area, still long hair. We can comb it and style it right after procedure. Um, Non-shaven, or how we call it here, celebrity hair transplant, is when we remove hair and we don't really care about the shaft being long or not, but as long as we don't shave the donor area, is considered celebrity hair transplant or non-shaven hair transplant. We have different techniques to do that. We started doing long hair several years ago when Trivellini system came up with the long
Mm.
hair punch and long hair device, and it was very exciting. A lot of people were asking about it. Like everything else, we wanted to try it out and see how it is. The reality is, there is minimal advantage of doing long hair. It does help us to see how patient eventually look, like it gives us a preview of final result. But when you look at it, even when we do long hair, some of those hair shafts are being cut.
Mm.
So it's not like 100% of them are staying long as they are. So the look that you see is not the exact look that people will see. The
Mm.
final look is also a little bit better. Um, and then the other fear that I always had with long hair transplant, when we remove hair with long hair shaft and transplant it, is that you expose patients to more risk of pulling hair out. Any touching hair, any combing, any accident can pull the hair out, as
Mhm.
opposed to when it's kind of very short, 1 millimeter, as we usually do. It's kind of more protected.
Do you think so? A lot of people, like myself included, don't want to shave their head, especially once you get a hair transplant. You got the hair.
Yes, that's a
Why?
problem. That's
Why
that's what.
would you want to shave your head,
The,
right?
the first
So
time is easy, right? So,
yeah, the
oh,
first time
there's
is
not much
like,
to worry about
yeah,
it.
like whatever, just shave it. It's a couple hair follicles, anyways.
Yeah,
But once you get the hair, you're like, and you got that illusion, you don't want to shave it,
no,
and then you
that's true.
spend the next 3 months looking terrible, and then
Right.
all your coworkers are asking, what happened to you? So in that case, do you think, and be honest with me, let's be completely transparent. Is it better to shave or to not shave?
It's a very good question. Very good question. So, uh, I prefer to shave. Whenever I can shave, I prefer to shave. In fact, when we don't shave, we charge more. So we call it celebrity hair transplant for a reason. So when we started doing this, I had a group of patients when we started doing FUE procedure, and we have been one of the pioneers. A lot of people come to us and say, we don't want to have the scar. There's
Yeah,
no way I can get a hair
yeah.
transplant. Prefer to be bald rather than having that long scar in the back. But I cannot shave either. I mean, there are certain celebrities that they just cannot shave even for a few months. They don't have that time. They're always in front of camera. They're always in front of TV. The TMZ is
Yeah,
following them everywhere they
yeah.
go. So it's not an option. And then we came up with that. Initially, we were doing it manually. So we were doing cutting a bunch of these follicular units and remove them manually with manual punch. And it was very labor intense. For that reason, we couldn't do more than 500 grafts per day. It was like a long day, 500 grafts, and these people have to come with multiple
Mhm.
procedures. So we called it celebrity hair transplant because my staff knew that the days that I'm locked in the procedure room, oh, I know that's celebrity hair transplant, and that name actually
Just stuck.
stuck.
Well, we're in LA too, so
That's
it's
right. And then the number of grafts got better. So we had more motorized system. We had Trivellini system. We started using this multiphasic system. So that gave me the option to go much faster. We didn't have to pre-cut. The machine does it. The machine cut the hair shaft and remove the grafts at the same time. So that gave us the option to go up and up on the numbers to the point that right now we can do 1,800 grafts per day. That's my limit. I mean, we probably can push it for more, but it's going to be a very long day. So we do, if a regular hair transplant, we promise a big number of like 2,700 per day. For celebrity hair transplant, we don't promise more than 1,800. Uh, Advantages, obviously no shaving. People move out. We give them, blow dry and everything. They walk out as they came in. There's no way anybody can guess.
Even if
Disadvantage,
TMZ is around the corner.
even if Sims is behind the door. Yeah. But the disadvantage is that the number of grafts are less. So for people who need more than 1,800 grafts, we have to do it in 2 days. We do that too. Like people come for 3,000 grafts, we do 2 days of 1,500 grafts. The other disadvantage is when we shave, we can see a little bit better. A little bit better. I'm not saying that day and night difference, but when we shave the recipient area, not the donor area, recipient area, we can probably plan a little bit better. So that's what it is.
Yeah, I mean, I think for me, shaving it sucks, but it's probably best to do it just
If you
to
have to.
minimize the risk. Which, and you said something about you want to try everything, you want to try things, which is my perfect segue. A lot of people have been requesting and actually asking me, and milk drinker. I'll get to your question right after this. Verteporfin. It was something that I brought up to you, I think maybe like a month or two
Yeah,
ago.
yeah.
I sent you the Stanford study.
Yes.
There's been a huge amount of interest in our community for surgeons trying it. And, I talked to you about it. You read the science behind it. Now, what do you think? Will you do a trial? Will you not? And why or why not?
You probably know my answer. I'm a little bit on the, if the science is right, I will be the first one doing it. I don't want to try it on my patients at this point unless we get more data. For the same reason, I never did PRP or ACell because the research was lacking for hair loss or hair restoration. And now we get more research coming out that they show long-term side effects. When it comes to the donor healing of the FUE procedure, we know that with current technology that we have, we use 0.8 to 0.9 millimeter punches. The scars, there's really, in many cases, I can say there's no scar. There's no visible scar. It might be microscopic scar, but visibly, even after shaving with razor, people cannot see. And occasionally, people have those hypopigmentations. That hypopigmentation is a combination probably of a scar and lack of hair. And in those cases, that's probably a good option to use something to improve the scar formation. But again, I wait for more data. The science is severely lacking behind on this, medication. But I'm watching it very closely. The moment that we have a good, double-blinded
Data.
study that shows that it's really working, I'll be the first to use it.
Excellent. And so, because a lot of people have been sending messages,
Sure.
and they know that you were at John Hopkins, and they thought, have him do a study because he knows how to design a study, and that's been the biggest concern. And I spoke with Dr. Bisanga, but like 4th of July weekend. And he said the same thing. And he brought up ACell. He said, I saw this 10 years ago, 12 years ago with ACell. People were saying it was regenerating hair. I was getting surgeons doing FUT and just packing it with ACell and not even closing it. And it was just a disaster. And so I'm very, 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 very skeptical.
Exactly.
Maybe if I get more evidence, then I'll try it. So I think you're in the same boat, which is totally, totally understandable. I can't fault you for that. But would you, if it does work, let's say it works, because I know Dr. Bloxham is doing it with FUT. If it does work and, the strip scar is like very, almost invisible, would you go back to start to doing strip?
Well, we don't do a strip anymore. I don't think there is any, I know a scar. This is my forte. this is so my thesis for medical school was facial plastic surgical methods to improve facial scars. So that was my interest from the beginning. And then when I came here and went to Johns Hopkins, we were working on wound healing. So we were making wound on the back of mice to inject them with the plasmid of basically DNA of growth factors and try to heal the wound.
Mm.
And so I know scar formation. I know something doesn't work when I see one. I mean, it's obvious. For people who don't know scar formation, the whole thing, they may say, "Oh my God, there is a magic formula. We can do this." It's like some of those things that come out every time. Oh, the cure of cancer is here. Cancer is just not one thing. It's just like a variety of different things. It's just not that easy. Somebody who knows the science, they know that's not real. But it's great. I know people get excited for everything. Like when we started doing laser, people come, "Oh, I want to have that laser hair transplant surgery." I said, what is laser hair transplant? So
I forgot about that.
yeah, when I was doing my this is even funnier. When I was doing my surgical residency, I had this lady coming and say, "I want to have laparoscopic breast augmentation." I said, "How did you even hear that laparoscopic breast augment?" Because everything was laparoscopic, right?
Oh yeah.
Cholecystectomy, this lap band, everything. So people think that this name should be, you know,
Yeah.
Anyways, so but the science is really not there, and when they are there, when we see enough evidence that we can start using in our patients, we tell patients that this is like still experimental, but we let them decide, and if they're okay with that, we use it. But we're not there yet. We don't have any evidence. What you said, I remember I probably made some of my friends annoyed back then when they were talking about A-cell and how to have to put it on the holes of the FUE because it heals better, it makes the scar better, invisible. I had the same argument. Say, there's no evidence. We cannot just claim that without doing proper research and documenting it. So the same answer.
But to play devil's advocate,
yes,
you're not going to get that answer unless you actually try it.
We
unless
can't.
There's enough doctors that actually
yes,
use it. They like with A-cell, right? There was enough doctors that tried it, and then there was evidence this doesn't really do anything.
But there's still a group of doctors that swear by A-cell because in their eyes we use A-cell and there's no scar. But yes, there's no scar because your technique is improved, because you're using fine punches. I don't see a scar in most of my cases. Should I say because I use this and that? So you see my point, right? In
absolutely.
this small clinical setting, we cannot be unbiased. When we do research, especially when we sell a product, we kind of believe it and we sell it. We want our patients to believe it. And deep down, not to be dishonest or anything. Honestly, people believe in it and they become biased toward it. And then they take it as research. This is not research. The proper research is to have 2,000 patients, 1,000, the exact same procedure. Half of them get this treatment, half of them get placebo, something similar that is not exactly that medication. And then they're being operated by a doctor who doesn't know what's what, and they're going to be evaluated by another doctor who doesn't know what's what. That's double-blinded study. If you can arrange that, we can say that's a good science. But I do this on 10, 20, 100 patients, another doctor does it. That's not research.
But wouldn't that be like a multi-center study?
They could do it. They could arrange that could come up with the numbers. Making it completely double-blinded is almost in this field is impossible. But we've done procedures like that. We recently have done study of different sizes of punches with Trivolini system, multi-center study, 5 centers, and we presented the result. But again, for some studies like technical comparison of devices, we could do that. For medication, it's a little bit harder.
Yeah. Well, if somebody said that's disappointing, well, guys, I think it's always good to hear doctors' perspectives and to get honest feedback. And I've always been one that I'm optimistic, but I'm never like fully like, okay, this is the end all be all. I was very optimistic, and I still am to a point. I'm still optimistic because I think there's like you said, there's not a lot of evidence, but there's not a lot of things debunking it either. Just
That's
like
right.
with
Optimism
ASAP.
is good. Optimism is the source of all inventions. And I'm sorry, guys, if I'm disappointing you. I wish I had this magic formula that could have solved all the scarring issues or any other problems that we have. But as a physician, as a scientist, I have to honestly tell you when something is working, when it's not working, or when we just don't know.
Absolutely. Let's start fielding some questions here because we have a couple questions that we haven't gotten answered here. Dr. Mohebi, can you talk about the change in the hair angulation going from mature to juvenile hairline? So I think he means so obviously juvenile would be completely straight,
They're talking
no
about hairline
angulation.
or hair angulation.
No, they're
Angulation,
talking about the angulation of the actual hairline.
actual
So,
hairline. Mhm.
juvenile would be angled straight, straight hairline. Uh, Mature hairline would start angling back
Going
towards,
backwards, yeah.
yeah,
So we have when we are growing from like imagine a 10-year-old boy with that hairline, and as you said, the hairline is lower, the corners are even curvy, sometimes coming down, the corners are closed. Not only straight, is the corners sometimes come down.
mhm,
Something similar to what we call a feminine hairline, if you see it as an adult. But in kids, in boys, they are like having it. Almost every boy has it.
yeah,
And then because we have different types of hair, the hair in front, they're not part of, they don't have the characteristics of the hair behind that mature hairline. So we start losing that hair, the juvenile kitty hairline.
yeah.
We lose them and stop at a higher station. And not only that, the corners go back. So when we design a mature hairline, we make sure that the front is here, the distance from the eyebrows to the center of the hairline is here. When you go to the corners, it should be at least 1 centimeter above that. That's
So,
like in
so
ideal
if you
cases.
have, if the center is 7 centimeters,
Mm.
the corner should be eight
Yeah,
centimeters,
pretty
and that
much.
would be considered a mature
Immature.
hairline.
So you need to see this V shape, a little bit of it at least. Uh, for men, we're talking about men mature hairline. Women is a different story. Women, not only it could be straight, it could come down. It makes it more feminine, more
Oh yeah,
beautiful
you
when it comes
definitely
down.
don't want to give, and the peaks right here for a woman, it's very like uh coming towards the eyebrow, whereas men it's more of like a triangle. For
Yes,
like Afro men, it's like straight and more of like a
that's right.
square.
That's right. Good, good. Good
Um,
review of the temporal points.
can finasteride weaken the donor area because this hair actually belongs to body hair and not head hair? My body hair on fin is thinner and less long.
I wait a second. So they're talking about
The
the
donor
donor body donor hair. So you had body hair transplanted to your scalp. Is that the
can weaken the. You know what? He's not clear here. I'm assuming donor area is the hair on the sides and back of your scalp, which finasteride should improve.
finasteride should not deteriorate your donor hair either way, but I think the question might be related to like testosterone blockage for people, assuming that you have a transgender patient, right?
Mm,
So they do a transplant from beard to scalp and body to transplant to scalp. And then they also go through the removed testicles, the source of the testosterone. They do female hormone treatment. So some of those people, some of those hormones we know, just lack of
Whoa.
testosterone will make your beard hair weaker. So that same effect could happen to the scalp. Although we've done a few patients of the same exact situation, and after many years, they still have a pretty decent beard to scalp transplanted hair.
Awesome. We got a question here. Doctor, how do you identify the border of the frontalis muscle and how long can you place a hairline if donor is not an issue? Or how low can you place a hairline if donor is not an issue?
So border of frontalis muscle, if you're talking about injury to frontalis muscle, it usually won't happen because what we do when we transplant here, we have a depth control on our site maker. So our sites are like 3.5 to 4 millimeter, depends on the thickness of the skin. So we're not even getting close to the muscle. I remember years ago when I started learning this field or learning how to do hair transplant, we didn't have the depth control for the site making. So sometimes we were going deep, and sometimes you feel like your periosteum has been touched. But in this case, we're not even getting close to that, so you don't have to worry about it.
Awesome. So this hair chemist is actually a YouTuber who is also a consultant for Dr. Safi, who's doing a trial in Poland. He says, with Verteporfin and FUET, is there a concern that tension post in the donor area and blocking YAP to inhibit the scar tissue process may result in stretching post-op? This, I think, is a concern. So YAP is the pathway, the scarring pathway.
Yeah. I again, for the reason that we discussed, I cannot answer that because I'm not fully aware of the science behind that mechanism.
And so he said, I mean the angles of the individual hairs, not the shape of the hairline.
Okay, so that's another topic. Angles of individual hair. If you look at, so consider a feminine hairline very similar to a kitty hairline. So woman hairline, which is starting a little lower, the corners come down, is very similar to a boy's hairline before they go through maturation. And for that reason, they follow the same angles. And when we do hair transplantation on a woman, we start from the middle. And instead of, so a normal mature hairline, when I start from the middle, the angle go 0 or 15 degrees from the basically horizon. But in a woman, we may start from there, but very quickly we start the turn and come down toward the temples from the very middle. In a mature hairline, we are pointing forward until we get to the 2 centimeter to the corner, and then we turn the angle to become like a temporal point. But in feminine hairline or in boy hairline, before a mature hairline develops, that angle change starts very closely to the center, and it becomes almost like this. This is pretty much the angle that I do for women, and that's the angle that you should expect to see in a boy.
Perfect. We got a Dr. Francisco Lopez who asked a question in what looks like Portuguese. And I can speak Spanish, but Portuguese not
They're
that
close.
much.
What
yeah,
is
it's
it?
very
Read it
close.
out
So
loud.
basically, he's talking about if there's going to be a definitive cure by inhibiting microRNA. So there was a drug called Cosma RNA. I don't know if you heard about it.
I don't.
It was
know.
very, very, very big. So basically, what Cosma RNA is it inhibits the formation of the androgen receptor by the RNA. And I'm not a researcher, so I'm not too sure. But basically, that's the science behind it.
Right.
It would inhibit the creation of the androgen receptor. So it's working by a different mechanism as dutasteride or finasteride. And there was a lot of hype behind it. I spoke to Dr. Sergio Vano, which is highly respected doctor in Spain. And I believe Dr. Oscar Munoz, the same, very, very respected. And they thought that it would be a really good drug. And I'll actually show you here. So, sorry guys, I'm showing them live right here. They were actually caught photoshopping their results. So here we go. And I'm gonna share. Let me try to share my screen here. All right. So
who caught them?
Sharing my screen. So this is just, I believe, someone on Reddit. So these are their before and after pictures on their website.
This looks like the same picture, right?
It's the same picture.
Same exact picture.
So all they did was they grabbed this area, and
yes.
So they just added the temples.
Yes. They cloned it to that area.
So
interesting.
Right there.
Yeah.
So that was the before and after. So
interesting.
Good
catch.
Pretty clear. I think pretty clear Photoshop.
Yeah. So this is a good example of, customer beware, and there is a reason people who are like religiously promote something, we have to see what's the gain. uh, and it's hard. I know it's hard for regular patients. I know you're not scientists. I know you just want to believe in someone and go for it. But sometimes it's good that we have like platforms like hair transplant networks that they can be unbiased and then try to find different doctors, get different opinions. Kudos to you.
Thank you.
So I think this is probably one of the best that we can do, to see, hear different opinions and not just blindly go with everything that comes to the market. Because a lot of these things in theory make sense. Yeah, blocking androgen receptors. Yeah, of course. Who doesn't want that? But again, even if you develop a medication like that, do you know how many side effects it has by blocking androgen receptors? What else could have happened to you?
That
It
was
could
my
be a
biggest
disaster.
question. So my biggest question was, how do you know that you're not blocking the androgen receptors anyway? How are they targeting it specifically on your scalp? And the other
Is it
thing that
even
they did,
possible?
the other thing they did was it didn't go through like a normal FDA approval because it was sold as a cosmetic. So it's being sold right now. It's from a South Korean company, and so it didn't go through the same rigorous testing that like a drug would go through, which I thought was weird because if you're altering your RNA,
How
I mean,
was it administered?
it's
Administrative medication.
basically it's a topical. So
Topical.
it's a topical, and like I think they actually show the how it looks. But there was a few people saying, well, I think they just somebody should be fired in their marketing department. They didn't do the right thing, and obviously
This promotion was done by the pharmaceutical company.
this promotion was done by a cosmetic company.
Oh my god,
It's not a pharmaceutical. It's a cosmetic company.
that's like a crime.
So yeah, but there was a lot of hype, and I honestly was I was excited about it because I mean I heard from Dr.
Hmm.
Vanya who is very respected, and he said it looks pretty good. There was another drug called pyrrolitamide. That one is actually a drug, and it's going through the clinical trials and everything. The Cosme RNA didn't do that, so that made me a little skeptical. I'm like, well, they didn't go through the same testing,
Right.
and now with the Photoshop, I find it hard to justify photoshopping your results. I
That's
mean,
right. I
if
mean,
you're not being honest with that, I mean, if you were to research a surgeon and you found that his website had photoshopped results, like that's it, done.
that doctor should
You're
lose the
you're you're
license.
you're off of my list, like
Yeah. Oh
forever.
no, that doctor should be just losing the license of practicing medicine.
So it's been a bit sad, but I just wanted to get your thoughts on it,
No,
and
it's
if you
it's
thought,
good. It's good to talk about this. This is not the first one. This is not going to be the last one. You're going to hear this on the market every few months. Oh, the cure for the baldness is here. Like like minoxidil. We minoxidil. I've been in the market until they published it.
oh
That
yeah.
the cheap medication for everybody's calling us. We need that in prescription. So they feel like this is something new, which is not. So yeah, media can manipulate things.
Which lead me to another question, but I want to get this question answered first here. Can you turn a mature hairline into a juvenile hairline by lowering it and changing the angles? If so, how many millimeters would you have to bring it down?
This is a good question. That's something we don't want to do. So if you are having male pattern baldness and you are losing hair beyond the mature hairline and you want to get a hair restoration, you want to bring it to the mature hairline. You don't want to bring it to the juvenile hairline. The reason for that is, even if you are, so we have these patients coming to our office, like 24-year-old guy who comes with a picture of when he was 16 and says, I want the same hairline. And he really believes that he looked better and so forth. But the problem is, if you bring that hairline to that juvenile point, first of all, it's not going to look natural when he becomes a little bit older. For a young man, it may still look okay to have a juvenile hairline. But when you become 50 or 60 years of age, it would look ridiculous sometimes to have a juvenile hairline. That's one problem. The other problem is, if you have male pattern hair loss and you're supposed to keep losing hair, you're supposed to go to class 6 or 7, you have a big area to cover, and all of a sudden you're increasing that surface area. So if atypically some people keep the hairline as a juvenile hairline, and you consider doing that, you have to understand that you're increasing the surface area. You may run into the situation of donor recipient mismatch. So you may have not enough donor hair to restore the entire recipient area. So these are different things. I've done something, yeah, minimally close to a juvenile hairline for like an actor who was shining as a teenage. I don't want to give too much information because people may recognize him, but he want to maintain that role for another decade. And he kind of almost twisted my arm to bring his hairline a little bit closer to that juvenile. We didn't make it completely juvenile, but I went more than what I usually do. And I justified it to myself. I don't like to do that. Don't ask for that. You may regret it in the future for the reasons that we discussed.
Perfect segue. Have you ever brought the hairline down to a 6 centimeter with a transplant? So we talked about 7 centimeters is the average, right? I think it differs. I think some Afro patients have like
May have lower. Yeah, that's right.
And then some Caucasian patients may have it higher.
Yeah.
So what's the lowest? Let's just say, what's the lowest you've ever brought a hairline down to?
Well, 7 is not a magic number. It could be lower than 7. It has to do with proportions of the face. So when we design a hairline, we look at the entire face. It's not just the hairline and distance of the hairline to the hair to the eyebrow. We have a golden ratio, right? The rule of thirds. Yeah. So we said tip of the nose to chin should be the same as eyebrow to hairline. That's usually in 90% of the cases are accurate. So that's an ideal looking hairline. Okay. Sometimes we go higher because we know hair is fine. Patients going through class 7 of hair loss, we have no choice but to bring it higher. And forget about that rule of third. Forget about that ideal beauty of the face with the intention of, providing a full head of hair. As opposed to bring it too low and we don't have enough hair. And sometimes this distance between tip of the nose to chin is not 7 centimeters. It could be 6 centimeters. I have done hairline lower than 7 centimeters. When we see these proportions are like, this is smaller, we have to go lower. And we do it in the cases that we know there's no family pattern of advanced class of hair loss. And in microscopic evaluation, we see there's no miniaturization on the top. So we know everybody in this family of this patient has only class 3 of hair loss, just lost the corners. And now we know that miniaturization, there's no miniaturization on top. So meaning there's no active hair loss on top. So in those cases, we can go lower, again, cautiously. It's not something you have to do in every case or everybody who asks for it. I still don't like to do that. But in certain situations, when we look at the facial proportions, we see that it works for that face. We can do it.
Which is a perfect question. Someone else asked if you can do a juvenile hairline if someone has an amazing donor, something like Ronald Reagan, which is, I feel like everyone always brings up Ronald Reagan.
He had such a good hairline.
When you say, it looks unnatural on an older man, they'll say Ronald Reagan.
I don't see unnatural. I see atypical. That's my phrase. It's not unnatural because 5% of people always keep it like that. Even my hairline is not very typical for an adult Caucasian of my age. So my corners hasn't been receded as much as it should. So we have atypical hairlines. We sometimes even give patients that atypical hairline if they have it. But as you said, that whoever answered that question was very smart. They mentioned the donor capacity. Your donor should be sufficient that if you lose even half of your hair or all of it, you still have enough hair. And now today with beard to scalp hair transplant, we have more options to give that. But overall, that's something we have to do it cautiously. We have to plan for it. You have to be a good candidate for that. Usually we don't do it. Occasionally, if everything meets, we do it. So I don't want to put it out here so people can start coming to us and say, oh, you promised.
You said,
give me that 6 centimeter hairline.
You said I could have it right here. So Danish Body, he's asked this question multiple times. He's wanting a suggestion for a hair transplant surgeon in Pakistan. There are about 7 to 8 ABHRS members in Pakistan. Need your suggestions.
Let's not. Many of them are my friends. Let's not just single one of them out. ABHRS is a good thing. It's good. You're in the right track. ABHRS is a American Board of Hair Restoration. They test people, oral examination, written examination, if they are member of ISHRS, if they're fellow of ISHRS. It's called Fisher, fellow of International Society of Hair Restoration Surgery. That's another credentials that people have to go through different things. They have to have publications, they have to have years in research, they have to have presentations. Those shows that this doctor does above and beyond. And more importantly, go and meet them and talk to them and see what feels right to you, and see their patients if you can. Look at the right patients. If you can see some patient models, that's even better.
Perfect. If one uses minoxidil and gets hair growth, body, facial, eyebrows, long enough that the hair turns terminal and then stops it, does the hair remain the same since no androgens are attacking it?
Did you understand it?
So I think he's saying if you get on minoxidil and you see all this additional hair growth, will it stay if you stop it?
Well, you said terminal. Terminal has two meanings. Terminal has a negative meaning, but in hair, when we talk about hair, terminal hair is a good hair, is a hair that is like a mature, full-grown hair. So if you are talking about minoxidil changes the hair character permanently, it doesn't. It's just temporary as long as you use minoxidil. What it does, minoxidil, so very, very, plainly, minoxidil changes the growth phase of the hair. So when you have like this miniaturized hair, that hair, instead of growing for 2 years, it grows for only 6 months, and it will never become to the fullest length and thickness, and then you lose them. Minoxidil makes that couple of months becomes like a year. So hair grows longer and thicker. And for the same reason, you see more number of hair in that square centimeter. So basically, you have more hair, whether it's a facial hair or a scalp hair. As long as you use minoxidil, you can have that effect. The moment that you stop it, everything goes back to normal. In fact, you may have catch-up hair loss, which is one of the side effects of minoxidil.
So there's been a lot of talk about oral minoxidil, and actually a lot of people have been coming out against it because of the side effects. I forget what it's called, cardial effusion. I don't know what.
There are some rare side effects, and they're more common. The more common side effects that are not, they're actually, we see them on a regular basis now that more people use minoxidil, is basically edema in extremities, so swelling in the legs and hands. And I've seen a few cases of it. Could be pretty scary.
Edema.
So that's one of those things that we want to make sure patients know about. There are many rare side effects that I don't think it's that worrisome. I haven't seen them, but this is probably one of the things that are bigger than probably what we thought.
So most people are worried about the tachycardia, the heart issues.
But those are temporary. They just go away, just like orthostatic hypotension and everything. It's just part of the hemodynamic change that we see with medications like that.
So in your opinion, low dose oral minoxidil, 2.5 to 5 milligrams, how safe is it for people to take?
Well, if you want to compare it with finasteride, let's compare it with finasteride for male pattern hair loss. I always prefer finasteride. People who cannot use finasteride, they have side effects. They cannot tolerate it. They have different reasons not to take it. That's the good alternative over topical minoxidil. So they're more, people could be more compliant to oral medications as opposed to topical. For that reason, I prescribe it. A lot of women who don't have the option to use DHT blockers, that's probably the only options for them.
Are there any other alternatives? What are your thoughts on, and it's a segue, what are your thoughts on natural DHT blockers? Because I put it in the actual title here, Mohebi Life.
Yes. Well, obviously, I believe in natural DHT blockers. They may not be as strong as dutasteride or even finasteride, but the research that has been done on them, and we have multiple studies, we don't see any typical side effects of DHT blockers.
Mm.
So for a lot of people who don't take finasteride for the fear or for the actual side effects, that's a very good, alternative. What we did in Mohebi Life, that was an invention based on my selfishness. So I was gonna get some DHT blockers. I said, you know what, I do miniaturization on the corners. My dad started losing hair at my age, so we have late onset hair loss. My dad had a hair transplant and everything at age like over 65, I guess. So he was against it. He didn't want to go do hair transplant. So
No?
I'm almost 7 years old. Why should I get? I said, Dad, that's bad for business. That you lose.
Having hair loss?
That's right.
They're gonna say, "What
So,
does your son do?"
That's
he does
right.
hair transplants. Then why are you bald?
Exactly. So the only problem he had after hair transplant, he had some problem in the airport when he was coming back from one of those trips, and they look at his passport and said, "Who is this guy? What did you do with this guy?"
Not you.
So my point is, I had this late onset hair loss, and I'm going to probably recede down the road. So I thought, okay, I have to do DHT blockers, but I want to go with the milder version because my hair loss is not that bad. I was going to do Saw Palmetto. I started doing a lot of research on Saw Palmetto and pumpkin seed oil. These are the two main DHT blockers. And I realized that there is no FDA approval required for these. And the companies who sell those and to package them and
You don't know
offer them,
what you're getting.
there is no basically need from the government or from any authority for them to do any testing. So it depends on what source they have it. They should trust that source, and they can put it in a capsule. So whether they are honest or that source is honest, nobody knows what they're taking. I thought to myself, if I want to use something, if I want to recommend it to my patients, I need to know exactly what's in there. So I started putting this company together, and we brought Saw Palmetto pumpkin seed oil from reliable sources, and we test them on a regular basis and randomly with like more advanced testing to get even the levels close to the levels of them, which is very difficult for herbal medications. So we not only put DHT blockers, we put every vitamin and mineral that you need for your hair. So everything that's essential for your hair, we put them in one capsule. So unlike many other alternatives in the market, it's just one capsule, everything's included, and you take one capsule per day. And when we do hair transplant for our patients, we have them use those after procedure for the first few months. And then you can still use finasteride if you have to. We can take that on top of it.
Perfect. And it's just to be clear, it's not an alternative to finasteride.
It's not. No, if you can take finasteride is probably cheaper and a little bit more effective. So that's good. Keep taking your finasteride. Don't stop your finasteride. But if you cannot take finasteride for any reason, if you believe that you don't want to get anything chemical or synthetic, you want to be on herbal stuff, this is a very good alternative.
And someone asked, finasteride or dutasteride, which one is better?
Well, finasteride is the only FDA-approved DHT oral DHT blockers. Dutasteride is not approved yet because the side effects are more. We know dutasteride is more effective. It's more potent for male pattern hair loss, but the side effects are significantly higher.
Got it. Can we hair transplant during condition seborrheic dermatitis? Because I watched Dr. Mohebi, patient who has cured scalp psoriasis after hair transplant.
Thank you for reading that article. Yes, we had a so dermatitis and psoriasis are not the same exactly. They're both inflammatory conditions of the scalp. Some people believe that's a
seborrheic.
No, the other one, psoriasis. Psoriasis is a more severe form of dermatitis, which it is, but pathologically they're a little bit different. So we believe that you can treat psoriasis with transplanting hair into it. So there's no contraindication. You can do that. And in 3 cases that we published, we showed that we could cure those lesions. Seborrheic dermatitis is a little bit different. I cannot claim that we can treat seborrheic dermatitis, but you may get similar effect. So if you have a lot of dandruff, a lot redness of the scalp, obviously hair transplant is not a contraindication. If you need a hair transplant, do it. And then if you have a good report, let us know. I've been looking into the numbers of cases. I've seen some improvement, but it's not to the point that I can claim that seborrheic dermatitis could be treated with hair transplant.
Perfect. Somebody asked, where do I buy your natural DHT blocker?
It's Mohebi Life. You can go to mohebilife.com and you can order it.
All right. How many centimeters is the lowest you would go with the hairline with a hair transplant?
You really want to bring that hairline low, huh? As we said, usually 7 centimeters. Sometimes I go 8 centimeters. Sometimes I go 9 centimeters. It has to do with a variety of different factors, with how uh, your future hair loss will be. What's your final station of hair loss? What's your family pattern? How thick your donor hair is? How dense your donor hair? It's not a simple answer. And don't expect anybody to answer that simple answer because it just doesn't work like that.
And somebody asked, is weekly dutasteride equal to daily Propecia? Like if they take one pill of dutasteride per week, is it going to be equivalent to taking
No, it's not.
Propecia?
It's not.
All right. And guys, we're running out of time here. So Dr. Mohebi, I want to ask you one question because I think it's super important. And most people don't know, but I actually went to you, man, it had to be like, I don't know, 8 years ago, 9 years ago, almost 10 years ago. And I had a consultation with you because you're one of the few doctors, and honestly, I think you're probably the only doctor in California, but one of the few doctors in the US that does a very comprehensive analysis of your scalp, of the donor, of the top. At the end, I got a paper with like my hair caliber, quality, my donor, all of that stuff. It was excellent. How important is it for patients to actually go in person for a consultation? Well, what's the benefit? Because
as opposed to like virtual consultation?
Yeah, because now, as you know, with the pandemic and everything, we got so used to doing everything virtually. Right. So what's the benefit of actually coming in person?
If you can, definitely that's preferred. Because there are certain things we just cannot do over the video or online communications. We check the density of your hair on the back. We check the thickness of the hair. We look at the different areas of the scalp and do a mapping of miniaturization of your scalp. That's very important. That tells me exactly where you're heading in the future. Even if you're just losing the very front, we can kind of predict that even if you go completely bald or not. I think these are the things that we cannot over the virtual consultations. However, we also do a lot of, video consultations for people who want to come to us from different countries, different cities. Yeah. In most cases, I should say like 80% of the cases, straightforward, never done hair transplant, no issues in the back and front. We can give them a range of number of grafts. And usually that range is a little bit wider because we never know until we see patients and see how deep this really is, the recession, for example. But when people come in person, we can be more precise. And in certain cases, I just don't accept them to do it only virtual. If there's anything fishy from the scalp, just by looking at them or the history that I get, I want people to come. Sometimes we need to do microscopic evaluation. Sometimes we have to do biopsy. Those are things you can never do over the internet.
Perfect. Last question from Jitvar. Doc, what good ways to limit scalp inflammation? And are there any good medical treatments for this?
I think you must be referring to seborrheic dermatitis, which is the most common skin inflammation. Skin inflammation is a huge spectrum from cicatricial alopecia area to all those. So many of them, you have to see a dermatologist, you have to be diagnosed with biopsy and everything. But if you're referring to seborrheic dermatitis that we just discussed, there are good shampoos out there. There are like Head and Shoulder, the shampoos that have certain ingredients. They're very successful in mild cases of seborrheic dermatitis. If it's more severe, you still have to go see a dermatologist and get more medicated, maybe steroids, sometimes even needed for severe types of inflammations of the scalp.
Perfect. Before I let you go, because I'm interested in having this, and I know a lot of people are interested. Have you heard of dutasteride and mesotherapy? It's basically like they inject dutasteride into your scalp every 3 months. The results have been really good. I think there's enough science behind that. Is that
Is it?
No, I mean the dutasteride is a proven
The
drug.
testosterone is good. Mesotherapy is a big question mark on mesotherapy. When you inject something to the scalp, it's just being absorbed. It doesn't stay there. So systematic taking the testosterone might actually work better. So mesotherapy, there's a huge question mark on that. Any type of mesotherapy started people with like vitamins and different, even growth factors, everything is going to be absorbed from the skin real quick. It doesn't last more than a few minutes in your scalp. A scalp doesn't have like a reservoir and like capsules to keep the testosterone and start feeding it
But
to the
doesn't it,
follicles.
if you inject in it, doesn't it go through your blood?
It does, but you can take it. You don't have to inject it to the scalp.
But I think the reason why people want to do that is they're scared that taking it orally would cause more. The same reason they want to take topical.
Yeah. No,
finasteride or anything
topical
like
might
that.
be different. Yeah, topical every day you do it, but mesotherapy do it just once a month and assume that it could work. That's there's no science behind it and there's no logic behind it.
So you wouldn't do it.
Absolutely not.
Okay, perfect. Before you go, how can we contact Dr. Mohebi? What's the best way to reach you?
Well, just parsamohebi.com. Yeah, all the information is there.
Email info at.
Yes, info@parsamohebi.com.
Okay, perfect. And at Parsa Mohebi on Instagram, right?
I believe so. MD.
Parsa Mohebi MD on Instagram and on TikTok for you youngsters. Hair transplant doctor.
Hair transplant doctor.
There we go. Thank you so much. Thank you guys. Does Jamie Foxx have a juvenile hairline after the hair transplant? Jamie Foxx, he uses concealer.
I think I posted something on him. So go on our TikTok and find the answer.
So go to Hair Transplant Doctor on TikTok and you'll get the answer. Thank you so much, guys. Till next time.
Thank you so much.